Sorry, I can hear you now. What did you say?
I said it's Christy Cam for the neurology office. You got a
Oh,
question about a urine?
yeah, so I'm wondering why I was admitted to the hospital with incontinence and sexual dysfunction, and Dr. Jillian Edwards thought it was serious enough to schedule me 2 CT scans and an MRI. And you think that my symptoms are serious enough to schedule 2 MRIs. Now, I had a urinalysis that said there was gram-positive cocci in bacteria in my urine, which is a leading cause of sepsis in adults as well as brain abscesses. And it can cause the incontinence, and it can cause sexual dysfunction, it can cause nerve damage. But while you think it's serious enough, my condition, that we should do MRIs, you think we should just leave the gram-positive cocci in there, even though some of them are MRSA, some of them are necrotizing fasciitis. Can you tell me which gram-positive cocci it was that was found in my urine?
So it was undetectable because the level was so low.
Actually, when the level is so low, you know what they say? They say within normal range. I'm almost 34 years old.
At that point in time, yours came back, it was very low in number, so there was essentially nothing specific to treat.
That's actually hilarious because I've had so many urinalyses, and when they are so low that they don't need to be treated, you know what they say for bacteria? They don't list whether it's positive or negative. They don't list what shape it is. They say within normal range, and that's when they don't get treatment. But when you have a bacteria which is very likely antibiotic resistant, which is very likely an anaerobic bacteria, which is very likely to go systemic, to enter the bloodstream, to abscess the brain and cause sepsis. And this patient also has incontinence and other genitourinary disorders. Usually you do treat that bacteria.
So at that point, when it's not as at a level that it's high enough, we do nothing. No action at this time is necessary.
Oh, really? I'm just pissing myself for no fucking reason? I just can't feel anything from the belly button down for no reason? It's not necessary to treat it? That's what you're telling me?
Check, right? Because when folks have issues with what you're describing, our priority is to check the lower back. At that point, the MRI of your lower back didn't really reveal too much of what could be contributing to you.
Yeah, just a herniated disc.
Because those are the next two important things.
Right, so a herniated disc, very... I am beyond belief at what you're saying. I hope you know that our entire interaction this morning and every interaction that occurs, whether in office, over the phone, I've been recording all this, so this is very fucking interesting.
So I'm just trying best to get to the bottom of what you're concerned about.
Yeah, I'm just trying to wonder why I'm pissing myself, and you're sitting here saying you don't even deserve an antibiotic.
Your lower back has been checked. We actually did a CAT scan of your neck as well. I would like to get an MRI to make sure that you're not pinching a nerve that could be related to how you're feeling.
Yeah, maybe because they have an osteophyte complex. That could pinch a nerve, couldn't it? It could cause spinal stenosis, too. But we're just going to leave the UTI here, let it get worse. I don't know what number of bacteria you're waiting for until I deserve treatment, when I already basically can't feel almost anything from my belly button down. I'm having abnormal reflexes. Constant urge to have a bowel movement, but almost impossible to do so. No feel. Yeah, but you don't think we should use an antibiotic? Yeah, maybe that's a good idea. Maybe we should do that. I pray to God that they're just over the threshold at which you think they should maybe be treated. Maybe before I go from pissing myself sometimes to every goddamn time, because I don't want to end up in a diaper because you think it's not important.
I did not say that.
Oh, no, you just think it's unnecessary to use antibiotics while you got a patient that can't feel nothing down there fucking randomly peeing.
Right.
You don't think antibiotic might be the first line of treatment? I wonder what Horizon Blue Cross Blue Shield would say over the fact that you're refusing an antibiotic but you're ordering MRIs. Maybe we should do both.
I never said that. I never said that.
I want an antibiotic. I think that I need an antibiotic over the fact that I'm increasingly fucking urinating without awareness.
I understand that. I just said that I would order you what you needed. If you're looking to get your urine tested again, I'm happy to order that for you.
Yes, please. And
have them. I would prefer
And
them.
I'm gonna need you to send me these because I'm gonna try to see if I can get the fuck out of Cape May County and get this done somewhere that they don't play games. So I'm gonna need the
Okay,
urinalysis
no problem. We'll just send you
request
the
as
script,
well as the
okay?
MRI request.
Okay, we will send you the script. That's not a problem. We'll
Yeah,
send you
because
all
I
the
went to
MRI
Cooper
too.
Hospital after Dr. Jillian Edwards specifically sent me there for imaging because I was incapable of laying down for the EMG nerve conduction study. And Nurse Priya or Dr. Priya or whoever she calls herself looks at my back. I show her an indentation the size of a thumbprint. I show her the fact that one side of my rib cage is inflating when I breathe and one is not. And she said, oh, that's normal. There's nothing wrong, and refused to image me. Then I go to AMI imaging, and you know what they find? 3 broken ribs, a piece off of my L2 lumbar vertebrae.